Oral questions by members.
Member for West Vancouver, Capilano.
Thank you, Mr. Speaker. We know women have been disproportionately impacted by the pandemic, and unemployment for young women is 11% higher. Women have dealt with the stress of juggling work and childcare needs. 4 years ago, this Premier promised to, quote, bring in $10 a day childcare, end quote. But he has failed miserably to do so, and instead of actual assistance today, parents get bungled and multiple misleading government news releases. Can the Premier confirm that only 6,000 childcare spaces have been opened to date by this second-term government?
Minister of State for Childcare.
Thank you, Honourable Speaker. For many, many years, British Columbian families have been struggling with the lack of affordable, high-quality early learning and childcare opportunities. When we became government in 2017, we were faced with a childcare chaos and crisis with the previous government, the former BC Liberal government's inactions that caused families to struggle for many, many years. We've started that journey to build and bring in a universal, high-quality, inclusive early learning and care system with over 3 dozen of strategies, including the fastest space creation ever in BC's history. And to put that in perspective, we have created and supported the creation of spaces twice more than the BC former Liberal government has created in 16 long years.
Member for West Vancouver, Capilano supplemental.
Thank you, Mr. Speaker. Well, interestingly enough, between 2005 and 2017, the BC Liberals created 39,959 spaces, which is on average 3,030 spaces per year. So let's hope, Mr. Speaker, that the Premier's NDP math isn't being taught to our children. In estimates, the minister was clear, quote, 6,000 spaces have been opened, end quote. The Premier told every family in British Columbia they would get $10 a day childcare. He has failed to deliver. Will the Premier commit to stop with the talk, stop making even more promises and announcements, and actually deliver on the ones he's already made to parents?
Minister of State for Childcare.
Thank you, Honourable Speaker. The member opposite can throw out any information they want, but that's incorrect. We have been accelerating the creation of spaces.
Members, come to order.
Well, we have been accelerating the creation of spaces and created twice more of the spaces in 3 years than the former BC Liberal government has created in 16 years together. And we have been bringing affordabilities to tens and thousands of families. 90% of providers in this province are joining our fee reduction program to bring down the cost of childcare up to $350 a month, when the former government actually took away childcare subsidy from BC families that caused families to face fee increases of $100, $200 per month. We are bringing $10 a day and affordable childcare to tens and thousands of families in British Columbia. We're proud of the work that we do when the other side of the House voted against our Childcare BC plan every step of the way.
Member for Fraser-Nicola.
Thank you, Mr. Speaker. So we have a quote from the minister from estimates last week, and I quote, about 6,000 spaces have been opened. So, which information is true?
Member,
Is
one
it
member
the
at a time.
estimates, or is it the minister's statements today talking about throwing out numbers? Mr. Speaker, it happens all too frequently. The Premier makes a big promise, then botches it and hopes people forget. People like advocate Sharon Gregson hasn't forgotten. Quote, it is not okay for the BC government to put forward a minuscule commitment compared to what they promised, end quote. 2 elections in a row, Minister. The Premier made the promise of $10 a day childcare, and then he bungled it. Can the Premier tell us why he has chosen to break his promise to parents not once, but twice?
Minister of State for Childcare.
Thank you, Honourable Speaker. We need to remember where we came from. The former BC Liberal government has left a chaotic system that we have been trying to fix since 2017. And I'm going to share this with the opposite member that they need to face the reality that it is since we became government, every single week, there is a new childcare spaces being created and being supporting families across BC communities. This is what a single parent, Sarah, has to say if the opposite member doesn't want to hear what parents are saying. Then why are you asking the question when you've neglected the childcare crisis for 16 years? Through the chair, sorry. This is what Sarah, a single parent, has to say. The new affordable childcare benefit has been tremendous help to my family. As a single mom, this financial support has been instrumental in giving me the opportunity to go back to school to return for a new profession. And that was not available when the other side of the house were in government. We have bringing down the cost of childcare to tens and thousands of families. We are creating new childcare spaces across BC communities every single week. We are supporting early childhood educators with a wage enhancement. This year, September, early childhood educators will get a $4 an hour wage enhancement. When the other side of the house, when they were in government, they took wage top-up from early childhood educators.
Who's asking a question, please? Can we have one member asking a question, or everybody wants to ask a question? Member for Fraser-Nicola.
Thank you, Mr. Speaker. Well, to the minister, the numbers you're throwing out, a child care space every week is 52 spaces. Last week, it was, in estimates, about 6,000 spaces have been opened, and that's a direct quote from the minister. So what is it, Minister? Despite the Premier's clear promise 4 years ago, the minister confirmed in estimates that there is no plan in place for universal $10 a day childcare. Quote, different funding models are definitely being taken into consideration, end quote. This Premier has gone from universal $10 a day daycare to prototype sites to some alternative plan. Can the Premier tell us exactly what this alternative funding plan is?
Minister of State for Childcare.
Thank you, Honourable Speaker. I really want to take this opportunity to thank all the childcare providers, early childhood educators, advocates who have been working with us together to make sure we can create an early learning and care system for BC families. We need to learn how to bring down the cost of childcare when the other side of the house, when they were in government, ignored the crisis. We have a fee reduction program that's bringing down the cost of childcare up to $350 a month, with 90% of providers joining this program. We also have the affordable childcare benefit.
Members, Minister, continue.
We also have the affordable childcare benefit that brings $10 a day childcare to tens and thousands of families, along with the prototype site. So many families has benefited from our program, and we have this space creation that's the fastest in BC's history. And if the member opposite want to hear what community is saying, this is a quote from the city of Prince George. I quote, Chris Bone, the city of, from the Prince George social planner manager, is saying, I quote, at the time when the former Liberal government, that's, I continue to quote, there wasn't enough money available to help creating spaces that were required for childcare. But the environment is very different in 2019 because thankfully, we now know there is funding available to help create the spaces. And that's the actions our government has been taking when you ignored the crisis for 16 years.
Members, you're wasting your precious time. Leader of Third Party.
Thank you, Honourable Speaker. As low case numbers hold steady and more British Columbians get their first dose of the COVID vaccine, it has been a sigh of relief after a year and a half, almost a year and a half of severe stress. and we have a lot of reasons to be cautiously optimistic. And yet, once again, we can see trends elsewhere. In the UK, due to the Delta variant, the 7-day rolling average of cases has doubled from 2,400 on May 28th to 5,000 on June 7th. Yesterday, Dr. Gustafson said that the Delta variant of COVID-19 is still, quote, relatively uncommon, with just over 500 cases identified in BC. In the Peel region of Ontario, however, they're just a couple weeks away before the variant takes hold, according to their medical officer of health, Dr. Lowe. And in Nova Scotia, Chief Medical Officer Dr. Strang says that while the province is, quote, at the tail end of the third wave, the Delta variant, first identified in India, is something to be concerned about. The emerging information, Dr. Strang says, about the Delta variant shows it is more easily transmitted and not as well protected against by one dose of the vaccine. This is further evidence to how we need to remain cautious until the majority of Nova Scotians are fully vaccinated. In a few short weeks, Canada-wide travel may be on the table, including to regions with high transmission of the Delta variant. My questions for you, Honourable Speaker, is to the Minister of Health. How is his government managing the risk of that the Delta variant poses to the many British Columbians with only one dose of the COVID-19 vaccine?
Minister of Health.
Thank you very much, Honourable Speaker, and thank you to the member for her question. What I think the evidence suggests is that we have to continue to pursue our immunization campaign with the kind of speed we've been engaged in the last month. For example, last week, 380,000 new doses administered in our province, significantly more. And as at the end of the week, 98% of the Pfizer vaccine that we had received from the federal government was in people's arms, which I think is an extraordinary achievement. It's also the reason why we have taken a step-by-step plan to limiting or easing restrictions in British Columbia, such that the step 2 will not occur before June 15th. And the step 3, under any circumstances, won't occur before July 1st. Step by step, prudent approach. In addition, and this is a concern, as the member suggests, with other jurisdictions that may have lower levels ultimately of immunizations, such as some areas of the United States, and less testing for variants of concern, less whole genome sequencing than is done in British Columbia. The best way, as Dr. Gustafson said yesterday, for us to prevent against these variants is to continue with first dose and second dose immunization. That's exactly what we're doing. We're continuing to monitor the COVID-19 pandemic and continuing to take a step-by-step approach to the easing of restrictions, considering every day the circumstances on hospitalization, on critical care, on cases, and on vaccination.
Leader of Third Party Supplemental.
Thank you, Honourable Speaker, and thank you to the Minister for the response. And yes, vaccinations and the immunization program, as we can see, are moving us in the right direction. However, the variants and emerging variants of concern remain a problem in many places in Canada and the world. The one thing that British Columbia hasn't done that other places have done is to lean into rapid testing. Yesterday in Nova Scotia, the Halifax News reported that the government in Nova Scotia is going to expand rapid testing. Again, this is a quote from the newspaper, "We've been working with employers and the federal government to pilot a workplace testing program across the province," said the Chief Medical Officer of Health. Almost 50 employers, as well as the Halifax Chamber of Commerce, have signed on. Dr. Strang says these employers will get free rapid point-of-care tests, as well as training and support to help them set up testing programs in their workplaces. As they went through the recent third wave, Nova Scotia has determined that they discovered 10% of asymptomatic cases of COVID through their use of rapid testing in that province. My questions for you, Honourable Speaker, is to the Minister of Health. We've learned a lot in the last 16 months about COVID-19. We've been able to look at other jurisdictions and how they've responded and what has been successful and not. As we enter into this phase of the pandemic, where we hope to see the cases reduced, will we be more assertively going for an elimination strategy that uses rapid testing in order to keep our cases low?
Minister of Health.
Well, Honourable Speaker, one thing that has worked in British Columbia, and we've seen it as other jurisdictions have reviewed what has happened, especially with respect to testing, we have done in British Columbia, is have our provincial health officer and our medical health officers lead on the question of testing, to use the gold standard PCR testing principally, and to incrementally use more rapid testing, which is what we're doing right now. We will continue to follow that advice of experts, of putting the resources and the means in the hands of experts to deal and to reduce the transmission of COVID-19 in British Columbia. I think that is and continues to be the right course. Of course, the government and public health does not always get it right, but we have continued to adapt and put the resources in the hands of those that can make the best decisions for all of us. And we're going to continue to do that. There will be, and there will continue to be, as the technology improves, greater and greater use of rapid testing in British Columbia, as there are in other jurisdictions. And the decisions around what we should do in that regard will be led by public health, as they have been from the beginning of this pandemic.
Member for Surrey South.
Thank you, Mr. Speaker. BC has the dubious distinction of having the worst gender pay gap in Canada. Between the COVID-19 pandemic and this government's failing childcare promises, things aren't looking a lot better. The Premier could start by keeping his snap election promise to pass pay equity legislation, which has been introduced 4 times now by the official opposition. Will the Premier keep his promise to voters on pay equity?
Minister of Finance.
Thank you very much, Mr. Speaker. Well, I'm really pleased to get up on my feet and talk about equity. We just heard from the Minister of State for Childcare, who talked about a significant childcare plan, finally organizing for the lives of women. So many of us have suffered and struggled to find childcare, and we finally have a plan in place here, Mr. Speaker. That is the biggest social program we can do for equity for women in this province.
Member for Surrey South Supplemental.
Well, it's disappointing that the minister is completely missing the point. This isn't about childcare. It isn't about minimum wage. It's about pay equity. When I first proposed pay equity legislation, the Premier called it, quote, a political stunt, end quote. With the pandemic having delivered a crushing blow to gender equity, the Premier's still missing in action. How much longer will it take the Premier, or will the Premier make women wait on pay equity? It's a simple question.
Minister of Finance.
Thank you very much, Mr. Speaker. Well, women are often the servers in the restaurant industry. I'm sure the member is well aware of that. I'm sure there's as many of us who've had that role. And we got rid of the server wage. If I recall, the other folks on the other side of the House thought that was perfectly acceptable, Mr. Speaker. We've done more for women than the people on the other side of the House have ever done.
Member for Surrey White Rock.
Thank you, Mr. Speaker. We know we're in a crisis when it comes to addictions and mental health. And we know the plan laid out by this government is simply not working. A report from the BC Women's Health Foundation shows that over 40% of women in British Columbia don't have access to the mental health they need during this pandemic. More than 40%. This government is failing women who need assistance. My question to the Premier is a simple one. Will he provide women with the help they need, not based on their ability to pay, but solely based on their need for treatment?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. At the foundation of our government's work through this ministry, the first time that a Ministry of Mental Health and Addictions has been established in Canada is to build that system of care that did not exist when we formed government. We've been working hard every day to build up that continuum of care so that people can access both mental health and addiction services when and where they need it. There is more to do, there is no doubt. but the progress that we have been able to make already, I imagine that the member opposite would be in support of. We've just put a historic $500 million for mental health and addictions service so that people can get care when and where they need it into this year's budget. There's never been such a new infusion of investment into British Columbia's in the province's history. I would imagine that the member would support our the 100 new adult treatment beds that we've added this year already, our budget commitment to do another almost 200, our expansion, particularly during COVID, which has made everything worse, from the addictions crisis to mental health, for us to stand up new counseling grants, for us to put $25 million into the system in quick order with the support from across the aisle, to stand up community counseling grants, particularly focused on women, our new investments in eating disorders, into every single health authority, and working with nonprofits on the front line. There is more to do, but absolutely we are working hard every day to build that system up, despite the setback that the pandemic has posed.
Member for Surrey White Rock, supplemental.
Thank you, Mr. Speaker. And given this minister's past performance in last week's estimates, I was hopeful, optimistic, that she would not continue to politicize incorrectly, I might add, such an important file such as mental health and addictions, but she continues to amaze. What I will point out is from the study, 2/3 of women that are essential workers are experiencing worry, anxiety, or stress, and 2 in 5 are experiencing depression. 63% of younger women reported feeling worry, anxiety, or stress. Indigenous women and those from a minority community are more inclined to rate their emotional health poorly. So again, to the Premier, will he do the right thing and ensure the services are provided and that no one has to choose between feeding their families, paying their rent, or getting the support they desperately need?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. In every way, despite the setback of the pandemic and the huge surge of stress that people are under, everybody's mental health is worse. The toxic illicit drug supply is more poisonous and more people are dying every day. It is a tragedy, and one that we have tried to stand up new resources every day in order to meet. But keep in mind, and while fighting 2 public health emergencies, we've been building up a system of care, expanding Foundry, enhancing suicide prevention in post-secondary institutions, standing up 24/7 access to counseling, no cost and low cost counseling across the province, virtual counseling available in every region, 80 new seats to train new mental health workers. At every aspect of the healthcare system, we are building in new supports for people. There is more to do, no doubt. But if the member's going to make comments about my performance in estimates last week, for him to spend 3 days with the minister and not ask a single question about Pathway to Hope, not a single question about the service plan that we're required to file associated with the budget. If he wanted to ask questions about the system of care that we're building up, he had 3 days to do it and failed to.
Member for Peace River North.
Thank you, Honourable Speaker. The minister keeps talking around the issues, which isn't what women and those suffering with mental health issues need right now. They need the minister to listen and to act. More than 40% of women reported not having access to the mental health supports that they need. Getting help requires a referral from a doctor, which can take months, or private counseling, which isn't covered by the province. Will the Premier commit to actually investing...
Let's listen to the question, please.
Will the Premier commit to actually investing in a seamless mental health and addiction system that ensures people get the help that they need it, when they need it?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. That is exactly the system that we are working hard every day to build, one that did not exist before, one that we are investing in unprecedented ways through our budget. But here's some of the tools that we've already added to the mental health, addictions, and healthcare system that are already making, despite the setback that the pandemic has posed, that are already creating more access to people regardless of their pocketbook. We are embedding mental health care services on a team-based approach across the province to have already opened 23 new urgent primary care centers. That is same-day access. We've opened BC's first mental health and addictions substance use urgent response in Surrey, opened a 75-bed new mental health and substance use wellness center at Royal Columbian last August, provided $15 million to 49 community organizations to provide a no-cost and low-cost counseling, $2.4 million to 20 other organizations to expand counseling virtually and in person. We're helping to train 100 South Asian youth ambassadors to be able to help get the word out to people and remove the stigma about asking for help. We've expanded Foundry Virtual and now funded a new Foundry app so people can engage in an online system, again, no cost, built for and by young people, and the list goes on. There is so much more for us to do, but in every way, there's more support available for people who are in need, and we urge anybody who's struggling under the mental health impacts of COVID to ask for the help that they need, and we will get that to them.
Member for Peace River North, supplemental.
Mr. Speaker, the results, though, aren't there for everyone to see. The minister continues to speak off of her stale speaking notes day after day with no end in sight, and the crisis continues to worsen. The reality is, and particularly women, they are not getting the help that they need. Racialized women face even more challenges. Michaela Shannon with the Support Network for Indigenous Women and Women of Color says, and I quote, for a racialized person...
Members will come to order.
For a racialized...
Members.
So I'll read a quote again from Michaela Shannon with the Support Network for Indigenous Women and Women of Color. And she says, for a racialized person to be able to speak to a therapist from a racialized background, someone who understands the negative and traumatic effects of racism from their own personal experience makes a massive positive impact in the success of their treatment, end quote. The Premier's in charge. His budget is bigger than the mental health and addictions budget. So will he take leadership, break down the barriers, and get these women the help that they need?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Anybody that is struggling with mental health challenges, and lots of people are, and addictions as well, please go to our website, gov.bc.ca/COVID-19 mental health supports. You'll see a whole list of translated services.
Members from the opposition bench, please come to order. Minister will continue.
Services that are translated, services that are being stood up by fantastic community organizations, multiple languages. Please, we want people to reach out. If the member has got a particular constituent that he wants me to talk with, I'm very happy to learn more. But I'll also note that $2.7 billion is spent every year on mental health and addictions. I'm sure the member would be glad to know, not inside a new ministry, but integrated across government through the healthcare ministry, through education, through Ministry of Children and Family Development. That's the way we're going to tackle this terrible mental health and addictions crisis.
Thank you. Opposition House Leader.
Thank you, Mr. Speaker. Well, let's be clear. This is a minister that's a minister on paper only, and by the answers in in estimates last week, it made it very clear that every other minister is actually responsible for approving funding and programming or not. But, Mr. Speaker, it seems day in, day out in this House, when we bring forward questions...
Minister, come to order, please. Opposition House Leader, continue.
Thank you, Mr. Speaker. It seems every day in this House when we bring forward questions and concerns from our constituents and people across this province, this government gets very, very amazed that we would have the audacity to remind them of their own promises and their own commitments and refuse to actually acknowledge or answer based on those. Today, we asked very simple questions, straightforward questions about their twice promised $10 a day universal child care. We asked the minister about her own statements and estimates only a week ago that only 6,000 spaces were created under this government's watch, and instead this minister has the audacity to stand in this House today and try to give a completely different answer. We asked questions and try to get a bill called on pay equity that this government has promised in elections to bring forward. If they don't want to debate our bill, where is the government's bill after 4.5 years, after 2 elections? Instead, the Minister of Finance gives a very dismissive question that ranges around everything and anything to do but pay equity. And then we get into mental health supports for women who have been disproportionately impacted by the pandemic. So again, to the Premier. The Premier is in charge of all of this. The Premier has made promises in 2 elections on all of this. When will the Premier start to deliver even one of these things? The Premier has also said that he's all in favor of a good idea no matter what side of the House it comes from. So when is the Premier going to live up to even one of his commitments in this House? And when is the Premier, at a minimum, going to start bringing forward the supports that the women that have been disproportionately impacted by COVID desperately need for their mental health supports moving forward?
Minister of Finance.
Thank you very much, Mr. Speaker. Well, you know, I find it very interesting that on the other side of the House, you know, the members opposite suddenly have a newfound interest in women. I recall when they were in government, they actually eliminated the women's ministry. They eliminated it. Gone, just gone. They did nothing to advance the pay equity when they were in government. They absolutely ignored the rising cost of childcare. They even brought in legislation in 2002 that led to the largest layoff of women in this province's history. And these were racialized women, Mr. Speaker.
Members.
They slashed legal aid services, Mr. Speaker. That affected women so significantly. They even deducted childcare support payments for women on disability. They refused to protect jobs of people fleeing domestic violence. And of course, they refused to increase minimum wage, Mr. Speaker. Now, there is a lot of work for us to do to make up for lost time. We have a significant investment in childcare, the biggest investment in childcare in BC's history that is actively going on, thousands and thousands of spaces. We're building housing for women fleeing violence, again, thousands and thousands of spaces. We have a parliamentary secretary who is dedicated, absolutely dedicated, to making sure that all ministries are addressing women's issues. And we have representation, Mr. Speaker. We have representation on this side of the House. I can't wait till all of my colleagues are here. And on this side of the House, we have more women than the opposition has for all of their members, Mr. Speaker. And I can't wait to show everybody.
The bell ends the question period.